new weekly update we're going to start providing, not to replace any official source of information, but to help provide an on-the-ground perspective from a business owner and RN who lives in Lawrence, Kansas. So I want to start with a little bit of general COVID facts. First of all, Douglas County numbers this week have been slowly dropping. Great news. We have decided as a county to extend phase 3 of the reopening, including the additional bar closings and mask requirements, in hopes that the dropping numbers are in response to these measures. There's currently not a date set for bars to reopen or for the mask requirements to drop. I'd love to tell you a little bit about my experience the past week at the hospital. So first of all, outpatient symptomatic tests used to be 4% to 5% positives when this all started in March and April. Now that number has increased. It's about 12.5%. There's a lot of things that could be attributing to that, and right now we're still trying to gather what has been the increase in positives per number of testings that we're doing. Frankly, we are testing a ton more. All admissions are being tested, whether they're symptomatic or asymptomatic. So anyway, my job is at Shawnee Mission Medical Center, Advent Health Shawnee Mission. And at our hospital, COVID hospitalization rates have not really increased, but actually decreased, which is also great news. Last week, if you were able to catch the video, I also mentioned that generally speaking, the acuity is much lower now than it was back in March and April. We attribute that to better treatments these days, as well as the demographic who's actually getting sick. It tends to be younger people who are increasing the rates so dramatically. Another interesting thing, that while at Shawnee Mission, the rates have not increased for hospitalization, that really is only true in South and West Metro KC. In North and East Metro, hospitals are seeing a rapid rise. So even in different parts of the city, you're seeing variations in how quickly this disease is spreading. At the hospital, we're also abiding by the CDC guidelines of wearing eye protection. This is a new development. And just to be clear, this is only a recommendation for healthcare workers while in patient-facing encounters and the COVID status is unknown. So in other words, we're always wearing our masks, and we're particularly using the N95 if someone's at high risk for potentially having COVID. But we are now wearing goggles or eye protection all the time when we see new patients and the COVID status is unknown. This is not necessarily a recommendation for the public. It was just given for healthcare workers who are generally at higher risk. Here at RPG, I want to share with you a little bit about what we're doing in response. We are continuing all of our COVID precautions. As a nurse, I wanted to make sure that we had a screening process at the door. We're still doing that. We're still making sure that if you're having symptoms, fortunately, I'm not going to have you in the store today, but after you test negative, after you're symptom-free, fever-free, we'd love to have you back. We do have a full policy and procedure that we wrote in coordination with Lawrence Restaurant Association and their recommendations as well. Also following CDC, WHO, all those recommendations too. Another really cool thing that we've got is, while everybody wants to stay home, we want to allow you all to bring RPG home. That's the name of our new program, Bring RPG Home. Basically, you can have board games at your house through RPG. And so right now, if you're interested in this, hop online, rpglawrence.com, sign up for the alpha test because we are going to be going into beta sometime here pretty soon. And if you are part of the alpha, you're going to get 1 month free going into the beta. Another really cool thing that we're able to participate in is first aid at protests. And we're trying to do an initiative here, kind of grassroots level, providing a first aid class coming up here in the next few weeks as well. So if you're interested in learning some about how to take care of people at protests and how to stay safe, especially during COVID times, check us out for that as well. We've got Sidewalk Dining. The city has done this awesome thing where they have launched a plan for sidewalk expansion down Mass Street so we can put tables out on the street. It's safer out in the open, not in an enclosed space. And then they've revised that to make it even more effective, and we're so happy to be participating in that here coming up really soon. So we'll have outdoor dining. We're doing some menu changes, and if you're interested in to-go options, we're going to be doing to-go cocktails coming up. Super excited about that. And all of these things that we're trying to do are all coming soon in order to make things more accessible for you. I mean, we started this business as an attempt to build community. We want to continue that, even though the things have been so different lately in the past few months with social distancing and the pandemic and all that. If you have any questions, we have a new email address you can address these specific questions to: rpgnurse@rpglawrence.com. You can email me directly, and if your question is reasonable, I'll do my best to answer it. You can also leave comments on social media, YouTube, etc. Once again, we are not an official source, and we recommend looking to the local authorities, the CDC and the WHO, for the most up-to-date information. I'm Nate Morsches, an RN and president of RPG. We hope that you stay safe, happy, and healthy in this time, and we all continue to work together to help Lawrence thrive.